NCLEX-RN exam, there are many type of item questions, but one which everyone is going to get is priority questions because they consist of the clinical judgment and critical thinking. Now, you might already know the age-old strategies of how to approach a priority question. Maybe it's ABC, where we think about airway, breathing, circulation, and maybe it's Maslow's hierarchy, where we think about physiological needs are going to be the priority over psychological needs. Or maybe we are following the nursing process itself, where we think about assessment has to come before planning or before implementation or before evaluation. Now, they might work in most cases, probably, but when it comes to the critical thinking, synthesis, application questions, which you're going to get anyway in NCLEX exam, those questions will need a little bit more than these basic strategies. So today, I'm going to share with you 3 great strategies to use when you are trying to answer a priority questions. Let's look into it. Number 1 is determining whether the question is asking for something good or something bad. That means most of the questions will have some kind of focus already in the stem of the question. So it will be thinking about, am I looking for something most important I am supposed to be doing, like a good priority, or am I looking for something which I should not be doing, which will become the least priority? And the questions in priority can be a good one or a bad one, depending on the situation. Now, if it is a good one, most of the questions might look like, what is the most important thing to do, or what is the most priority case here, or what is the most appropriate thing to do? That will be the good one. However, if it asks about what is the most concerning, or what is something warrant intervention, or what is the least appropriate thing to do, now that is going to be the bad one. So making a clear distinction between a good one and bad one is going to be your number 1 priority strategy in answering this question. Second one is going to be figuring out whether the signs and symptoms given or the clinical manifestations which are given in the options, are they expected with the diagnosis which is given? Now, most of the options, when they talk about a patient, they will talk about there is a diagnosis already given. For example, if there is a patient with appendicitis, then we know that right side guarding or maybe pain in the McBurney's area, we know those are expected. So that's not probably a priority case. Now, when it comes to a COPD patient who is having shortness of breath on exertion, well, we know COPD patients are going to probably experience that when they have the activity or exertion, they might have shortness of breath. Now, is that going to be a priority just because of the shortness of breath appearing there? No, it won't be. Now, how do we distinguish that? It's how we know what is the expected clinical manifestations for this diagnosis. Those kind of questions or those kind of options are probably not going to be a priority. Now, what could become a priority in that case? When the appendicitis patient is having rebound tenderness and rigid abdomen, board-like abdomen, we know it's going into peritonitis probably. Now, that will become a priority. The COPD patient who is probably going to have acute shortness of breath, even at rest, now that patient is probably going into acute respiratory failure or acute respiratory distress syndrome, ARDS. Now that will become a priority. So it is very important for us to be able to distinguish between what is normal and expected or what is probably a sign of complication. Now, if it's a sign of complication, that will be your priority case. Now, the third strategy in figuring out what is the most priority information, that is giving the clues or looking for the clues which are given in the question and in the options. Sometimes there could be things which appear to be normal, however, or not that significant. However, it might be telling you something which is an underlying complication coming up. Now, the best example for that is when a normally oriented client becomes restless. Now, restlessness itself doesn't look like a priority. However, restlessness could be an answer because it is one of the early signs of hypoxia. Now, let's say there is a patient who is admitted with some femur fracture. If the patient is having pain, if the patient is having mobility issues, or if the patient is having slight redness, swelling, or tenderness, we know that's probably not going to be a priority because those kind of things are expected with a fractured femur. However, if the patient suddenly feels restless, anxious, then we know this could be a fat embolism which is coming up, and that will become a priority. So sometimes the options which tells you something which is not very significant in itself, like when we think about restlessness, oh, maybe it's the pain. No, probably it is the fat embolism. Or when we think about anxiousness, oh, maybe it's because they are admitted in the hospital. No, probably it is part of the fat embolism and the patient is suffering from hypoxia. So it's very important not to dismiss something like restlessness or anxiety just thinking that this is part of the deal. No, it could be a sign of hypoxia, and that will be your priority. Hope this was helpful. If you would like to have more information, more practice, and more strategies and real good course for passing the NCLEX exam, come to AppleRN, www.applern.com.